Good afternoon or good morning to you folks and welcome. On behalf of NAC, thank you so much for joining us. It is 12:59 Eastern. You're here for the SMBP forum. We're about to go live in about 1 minute and 30 seconds, just allowing people to go from the Zoom waiting room into the main Zoom room. You should see Judy on the front of your screen, one of our presenters, of course, today. I'm going to start sharing slides in just a second. Thank you. Again, good afternoon. Hello, everyone. On behalf of NAC, thank you so much for joining us. Elizabeth, right here. I will be your host for today. We're going to go ahead and get started in about 30 seconds, just allowing people to get into the Zoom room from either their link or the waiting room. Should be able to hear my voice, should be able to see slides on the front of your screen that I'm about to go into full screen mode. Alrighty, in the interest of time, we're going to go ahead and get started. Good afternoon or good morning to you folks, and welcome to this month's Million Hearts SMBP Forum. My name is Elizabeth Breidenbach. On behalf of NAC, thank you so much for joining us. Before we get started, I would like to review a few housekeeping announcements. First things first, you have joined this online event by either using computer audio or physically calling in. Either option completely fine, though we do recommend that if you're in an area where Wi-Fi can sometimes be a little bit spotty, physically calling in is the best bet. Chat box is open and we want to know where everybody's coming from. So feel free to locate the chat box. It's either at the top of your Zoom screen, maybe at the bottom, depending on your settings. So we'd love for you guys to go in there and just introduce yourself, maybe where you're coming from. For your first name will carry over from the Zoom registration. So let us know where you're coming from. And one of my favorite housekeeping or icebreaker things is, what are you drinking right now? It's 1 p.m. Eastern for me, so I'm drinking a glass of ice cold water. I did a daily trip yesterday on the plane, so I'm very dehydrated, but that's what I'm drinking. So again, feel free to introduce yourself in the chat. Let us know where you're coming from, and just a fun thing of what are you drinking. Just our friendly disclaimer here that the opinions expressed by the authors contributing to this project do necessarily reflect the opinions of the U.S. Department of Health and Human Services, the Public Health Service, and the Centers for Disease Control and Prevention, or the authors affiliated for these institutes using the trade names for identification, and only does not imply endorsement by any of these groups named above. Again, I want to thank you and welcome to this event. I'm going to go ahead and turn things over to Judy. Judy, the floor is yours.
Thank you, Liz. And good afternoon. I'm Judy Hannon, the Senior Advisor for the Million Hearts Initiative. And welcome to the first SMBP Forum of 2024. We're really excited that you have chosen to spend your time with us. Today, we're going to be sharing some insights from a survey on SMBP delivery during the COVID-19 pandemic. And the main reason we're wanting to do that is we know that there was a really rapid implementation of SMBP in telehealth, and we thought now is not a bad time to take a pause and ask you all what you've been doing to sort of evaluate, change, institutionalize SMBP in the ongoing healthcare delivery world. And most importantly of the objectives is to promote the exchange of information, resources, and opportunities. So that's where you all come in, of providing both your experience of what you're finding, your answers to other people's questions, and your questions. Next slide. The agenda for today, this is the welcome and overview. And then we've got Neha Sakdev, who will be talking about not just the article, but that process in general about sort of evaluating how is SMBP working for you. We know that SMBP works. In the next slide, I'll be reviewing a few things, but it really, the concept, and we're not there yet, sorry, the concept of sort of refining and redesigning your practice as your own implementation feedback tells you is what we really want to be focusing on. And for the open discussion, would love to be hearing, how have you been able to continue SMBP after you got back to regular practice? What did you need to do to institutionalize some of these things? Have you evaluated your SMBP delivery in the current days, and sort of what changes have you made? So I just gave you a whole bunch of questions to be thinking about, either answering or asking your own specific questions about that. We have been adding a do you know, just sort of factoid into these SMBP forums. And so today you'll hear from Deb talking about some research comparing at-home blood pressures taken from the patients with that taken from a nurse. And then, as always, updates and resources. And if you are aware of resources that we aren't sharing, again, feel free to put them in the chat. Next slide. With that, as we're talking about what changes might you be making to your the implementation of SMBP, we wanted to just pause and make sure you all were remembering last year's SMBP forum, where we really sort of redid an overview of key foundations of SMBP. So the concept that SMBP works, it works that much better when you are having clinical response to the SMBP results. If you could use a refresher on some of the sort of key guidelines that are out there about when and how to use SMBP, would encourage you to look at last year's SMBP forum. And with that, I have the great privilege of introducing Neha Sakdev, who is from AMA. Next slide. And she's one of the authors of the article we'll be talking about, and lives in the SMBP arena a lot. We were just talking about the fact that her at-home infant or toddler might even be able to say SMBP. With that, let me turn it over to Neha, and thank you.
Both actually should be at that point by now. So thank you so much, Judy. It is really a pleasure to be here with you all today. We can go ahead and go to the next slide. Just to introduce myself a little bit further, I am a family medicine physician and a communications specialist by training. And I've been at the AMA in my role over 6 years. And I spend a lot of my time talking to teams and organizations about SMBP. And so I thought that it would be a good time now to, like Judy said, take a pause and see where we've been, where we are now, and where we're going in 2024. So if we could go to the next slide, please. I do want to say these are my views and reflections, not necessarily those of my employers. And if we could go ahead to the next slide, let's get started and think a little bit about where we've been. And to me, I feel like we've made so much progress in learning about SMBP in different settings and seeing it used in a variety of different settings. And a lot has happened in the last few years that's helped support this. And so to just name a few things out of many, we have more clinical resources now. The self-measured blood pressure monitoring policy statement, or the SMBP policy statement, as well as the implementation toolkit, are two examples of such resources that are out there. We've made a lot of progress in coverage. We not only have established CPT codes for SMBP services, but we've made inroads in coverage for devices as well. And then speaking of devices, we've launched and grown our US blood pressure VDL, validated device listing. And when it started, it had about 10 devices. And where we are now is that we have about 80 devices. And so in all of this, there's also been national efforts like the National Hypertension Control Initiative and the US Surgeon General's call to action. And of course, and as part of all this, if we go ahead to the next slide, we had COVID. It wouldn't be fair if I didn't talk a little bit about the pandemic. And it's okay that we came to this slide, but what I wanted to talk a little bit about in terms of the pandemic was to really highlight how much of a shift we saw in clinical care and how quickly we saw teams adapting the way they delivered care to care for their patients with hypertension. And so we at the AMA, during the time of early COVID, we're working with NAC and CDC on a Million Hearts project, and we saw the opportunity to capture some of these adaptations and also get some insights from frontline clinicians on their experiences delivering care and the adaptations that were occurring. So we conducted a survey of health center clinicians. And just to highlight some of our results, unsurprisingly, many clinicians said their patients experienced care delays and disruptions because of the pandemic. And when asked what was done in response, many noted that their teams started using SMBP. And this really did align to what I was also hearing in my work at the AMA. We also asked teams, we said, this is a really good time to find out which of these adaptations are worth sustaining. Like, what would people want to continue and what else would help us in the future? And so in looking at that, what we found was that over half of people indicated that SMBP was an adaptation that was worth continuing and that they wanted to see continued. And when thinking about what would help in the future, addressing some of the coverage and access issues with devices was also mentioned. So based on these learnings and based on some of the work that we've done at the AMA, I think there's a few things that we can say about where we are now with SMBP. And so if we could go to the next slide. First, I think we've seen that it is feasible to use evidence-based SMBP in primary care and in real-world settings. I think we've also seen, and teams have seen, how valuable of a tool SMBP is in caring for patients with hypertension. But like many things in medicine, there are still challenges and barriers that need to be addressed and solved. So to talk a little bit more about each of these in one by one, we could go to the next slide. With SMBP and evidence-based SMBP, when I started at the AMA, SMBP had been in guidelines and recommendations for years, but I can't say that it was being done in a widespread way or a very formalized programmatic way. I think during COVID, a lot of that did change. And so again, in our survey, we found that a lot of people said that their health centers initiated or expanded the use of SMBP as a response to the delays and disruptions in COVID. We've also seen in our work at the AMA, a lot more teams start to approach SMBP with developing clinical workflows and processes and developing more formal SMBP programs to help get that integrated into clinical workflows and used in a structured and systematic way across organizations. Next slide, please. And so not only have we seen that SMBP can be done, and all of this has shown us that yes, it can be done outside of clinical trials, in diverse settings, pragmatically and in the real world. I think, like I said, we've seen that SMBP is valuable. And what we've seen and heard from teams that we've worked with is really positive response to using SMBP. One of my favorite quotes from the paper and our survey is very brief, very simple, but I think says it all, and it's home BP monitoring for certain, super successful. So providers, again, we're saying this is something we want to continue in our survey. And I think at the same time, it's also worth acknowledging that patients also like SMBP. Our colleagues at NAC have published a paper looking at patient experiences in SMBP, and they found that health center patients feel really positively about SMBP. Again, teams I've worked with, I've heard really wonderful patient stories about how meaningful SMBP has been for them. So it's valuable. We have always known it's been evidence-based, but really experiencing how it can help, I think, is something that's happened recently. Next slide, please. But of course, it is not perfect. We have challenges and barriers. Devices are one that was mentioned in our survey as something that could help address, if we helped address this, it would help in the future. We've also seen at the AMA that this continues to sometimes be a challenge, both accessing devices as well as having coverage for clinically validated devices. Technology. It's a lot more use of telehealth. That was another thing we found in our survey was that was dramatically increased or significantly increased, but it still can be hard to get data from patients to clinical teams and get technology and platforms integrated into clinical workflows. It also sometimes has barriers in terms of infrastructure to support teams or to support patients in using technology. And then lastly, payment. While we've established CPT codes for SMBP, there still is a need to expand payment for those codes and to increase use of those codes. So where does that leave us from now, and where do we go from here? I think there's still a lot more to come for SMBP. And if we could go to the next slide, I will tell you why. I think the VDL will continue to grow and evolve and be a resource for teams on devices. We know EHR changes are coming that will be supportive of SMBP. We are still working to expand coverage, but there are many places where coverage does exist. And so we have the opportunity to ensure that our colleagues are aware of that. And then for all the organizations and teams that started programs or expanded the use of SMBP, there's the opportunity now to iterate, scale, and evaluate those programs. So talking a little bit more about each of these, if we could go to the next slide. We know there's been regulatory changes and that an average BP field, a structured field for average BPs, will be coming soon to electronic health records. Next slide, please. I mentioned coverage. I would love to see this map be dark purple across, but this does show that there are places where we have coverage for devices and services and cuffs for Medicaid. And so again, we have the opportunity to ensure that our colleagues know that this coverage exists and know how to use it for their patients. Next slide. And then lastly, for clinical programs and clinical teams, there are even more resources. And one that I want to highlight is the SMBP Jumpstart curriculum. This is based on our experience working with organizations nationally on SMBP. It's a free digital curriculum. It has 15 micro modules. There's planning resources embedded in each of those. And the curriculum is really designed to help organizations plan for, start, implement, evaluate, and iterate on a program. And so we're going to drop the link in the chat momentarily so you have it. We are still evaluating it formally, but it's a great resource for teams to iterate, expand, and evaluate their programs. And so to kind of wrap us all up before we go into discussion, I just want to say, where does that leave us for SMBP now? And if we could go to the next slide. So to recap, we've come a long way. I think there's still challenges. SMBP is not perfect, but we've seen just how valuable it can be. And we've seen that it can be integrated and done in primary care. And so to me, I personally think the future includes more SMBP. And so with that, I'll turn it back over to Leanne or Judy for our discussion.
Thank you, Neha, so much for that wonderful presentation. I'm just going to pause here real quick to see if we have any questions that have come up for Neha before we move on to our next section of the session. I'll just pause here for a moment. Please feel free to raise your hand or you can throw it in the chat. And if we have some opportunity in this next section, if something comes up, we'll definitely pose that to Neha as well. I'll just pause here a second. Okay. All right. Well, if something comes up, please put it in the chat. I just want to say, first of all, hi, everyone. My name is Leanne White. So excited to be here with you all today. I am the Deputy Director of the NAC Million Hearts team. And just really elated to be with you all. I love your icebreaker. It seems like everyone's really hydrated, which is amazing. Lots of lemon water, seltzer water, and then coffee. Coffee is great. Love that. So we want to get into this next section of our forum and open it up because we really want to hear from all of you. We have such a great group here today across the entire United States. I went through our registration report today, and I just was amazed by how many people that are attending today that are just all over the US. And I know this is just a great opportunity for us to all connect. So at this point, we're going to go into measuring our SMBP success discussion. I really encourage you to participate in 2 ways. Please, you can raise your hand and I will unmute. And then you can also feel free, if you want to just to put it in the chat, and we'll kind of go back and forth throughout this section and alternate. So I'm going to start off with, we actually have a hand raised. So I am going to just go ahead and call on E. Spalding. So I took you off mute.
Thank you. Thank you very much. I raised my hand to ask a question about the presentation we've already heard. And my question is, are you finding, not Neha, did I say that right?
Neha, but close.
Okay. Are you finding that at the level of the staff, there is resistance to teach people, their families, the community caretakers, how to properly take a blood pressure measurement, the steps and such? Thank you.
Yeah, and let me just repeat that back to make sure I follow. You're asking if there's resistance with team members educating patients about SMBP? Did I get that?
Educating patients, their families, the caretakers, communities about how to accurately, the steps, but accurately taking a blood pressure.
Yeah, I'm happy to share some thoughts, and then if others want to chime in as well, please do. So I think to answer your question, I'll say yes and no. I feel like anytime you start something new in healthcare, you have to get buy-in, and so it's really important to make sure that teams know why that's so important and why it does require a change, perhaps, in what they're currently doing. In organizations where we've worked and we've seen that happen, I don't know that I think that once we've started to implement, teams see how valuable it is and have really embraced it. And that is my experience. I know others may have others, but yes, I think initially there can be some questions about, hey, why am I doing this? This is something more I need to do. But if you can get that buy-in and really provide people also with the training and support so they know how to teach patients and others, then what I've seen is that it is done and that teams, again, start to see how valuable it is. But I'll open it up to my colleagues to see if there's anything that anyone else would add.
Deb, did you want to?
Yeah, I was just going to respond that resistance doesn't seem to be what I've seen as much as challenges around workload, bandwidth, access, and trying to get it all done in addition to all of the other work that we're doing. So I do think that there's an opportunity to kind of have some more conversations about how to fully utilize the team in a way that is helpful, and where you could be using, where you need licensed people doing this work and where you can use unlicensed people, community health workers, digital health navigators are becoming a little bit more prominent in some of the work I've been doing, et cetera, to kind of expand that team and provide more bandwidth, so to speak, on the workload.
Wonderful. Thanks, Deb. And I just want to mention, we also have team members behind the scenes that are going to take a look at those questions and start answering those as well. So I want to just, go back to what Judy mentioned at the beginning about pausing and evaluating our SMBP delivery. And so definitely one question I want to ask the participants today is, what are the primary challenges that your team faced or is facing in implementing SMBP? And what solutions have you discovered to address them? And what solutions are still needed to address those challenges? And I have some hands up. So I am going to, Lauren Barraclough, I see your hand is up. I'm gonna ask you to come off mute. Hopefully that worked on your end.
Hi there. Yeah, I
Hello.
had, good afternoon, everyone. I had raised my hand to respond to the last question about patient compliance. We're trying to educate patients, families, and the patient about taking the steps to accurately measure blood pressure. And in my experience, explaining the why we do things so that it is more accurate, because when people take that time leading up to taking a blood pressure reading, they're sitting down, they're more aware of their environment, they're being more mindful of maybe stressors, the TV on, or things moving back and forth in their space. And I think taking that time helps them to be more mindful. And over time, they'll see how that affects their blood pressure readings. And I just think that comes with practice, and they'll see over time that that does make a difference. And so patient education, but also a whole person approach as to why that's important.
Wonderful. Thanks, Lauren, so much. I appreciate that. And great to see you here. I'm going to go to the chat just to make sure we're alternating here. So I just want to take a moment here to take a look. Will this program from Jacqueline Palmer? So will this program expand to community partners that monitor blood pressure, such as parish nurses who work in faith-based communities? These are areas where the community receive healthcare support. So Jacqueline, are you asking, will the SMBP program expand to community partners? I just want to make sure I understand that correctly.
And I'll take a stab. Jacqueline, I'm not sure when you say the program, what you might be referring to as the program, as far as if there's funding out there. You know, to me, what we're mainly talking about is in the clinical setting, the SMB, the taking of the blood pressure with connection to a clinician. There are lots of support programs out there that are usually framed as lifestyle supports, where taking your home blood pressure monitor might be something that is taught and encouraged. And there is a very distinct difference, which is the evidence that's there about SMBP, and we sort of talked about going over the review. It's with the clinical support where the difference is genuinely made. There are likely really important things that are happening with self-empowerment, understanding just hypertension in general, lifestyle feedback for the community-based programs. But most of what we're talking about in this forum has to do with SMBP as a part of the clinical process. Again, I'll sort of repeat, I think one of the things that we talked about last year and maybe the last call, the premise behind self-measured blood pressure monitoring is to get to blood pressure control by more feedback, more measures over time, a better pattern that allows the clinician to I don't want to say, change their prescribing. Everything is going well, there can be a maintenance. But most of what we're talking about on this call and this forum is the loop that SMBP helps provide to give more feedback to the clinician to be able to take action. So again, not 100% sure what you meant by program, but I just wanted to make that distinction, that for the most part, this SMBP forum is intended to help those that are in that bridge of patient is taking their blood pressure at home, clinician and clinic needs to respond and react. Thanks.
Wonderful. Thanks so much, Judy. Appreciate that. Our next question is coming from Lalani. Valencia, I'm going to go ahead and unmute you. Hi, Lalani. see, I'm gonna go ahead and, are you able to come off mute? Okay, Leilani, we're gonna try to troubleshoot that behind the scenes, and make sure we can get your question answered. Crystal,
Yeah, I'll offer, it's a similar answer to what I just gave to the one
Okay.
before. Is that again, if it's a SMBP program, the connection to a clinical setting is really important. If it's a support, you have hypertension and on occasion you'd like to take your blood pressure, or you've been instructed by your clinician to take your blood pressure. I think all of those supports, including the lifestyle that usually goes with them, that would be at a senior rec center, all of those can be supportive. Again, the data that gives us the confidence about SMBP working is as it's connected to a clinical setting where there's some feedback loop. So just to try to clarify, to me, the answer to Leilani is similar to Jacqueline. So the research is there on the clinical setting. There may be some research related to sort of the lifestyle, but done outside of a clinical setting, there isn't that connection for the clinician to then take an action. And that's where SMBP is really so helpful. And again, what we're attempting to talk about on the SMBP forum. Thanks.
Thanks, Judy. From Jessica Haas in the chat, can you speak about the digital navigator, and can I have an email for more information? And so I know we have Tyler Hamler, who's a digital navigator. Tyler, can you speak more on digital navigators?
Hey everyone, my name is Tyler Hamler. I was a digital health navigator from June of 2022 to about October of 2023, working in an FQHC here in Philadelphia. In my role, I would assist patients enrolling into a self-monitoring blood pressure program. If patients did not have the proper, like say a phone, I would help them with, getting a device, so a smartphone. If they didn't have internet access at home, I would also assist them with getting internet access so they could enroll into the program. I would also assist with any like troubleshooting issues, like downloading the app on their phone, using Bluetooth, any issues they may have while they were monitoring their blood pressure. So my role was, to support the blood pressure program and make sure there were no barriers to technology when it's for a patient that was enrolled in the program.
Thank you, Tyler. And that's amazing, working with the patient and in that shared decision making, the shared patient engagement, ensuring that they have what they need to be successful at SMBP. So thank you so much for sharing. And I think your contact information is requested in the chat if you want to put that in there. But did you also have a question? Okay. Thanks, Tyler.
I will follow up with for others. As you said that you did this, it's past tense. It makes me wonder if it was part of the COVID funding that went away and there isn't the digital navigator. If in the chat, you could say if you have any idea of what might be happening at the health center with them no longer having that. That concept of a digital navigator, of somebody that can help make sure that what we are training patients to do with an app and communication back and forth to the healthcare center is not a given at all. And the concept that somebody might be there to help make sure that the patient leaves with the ability to actually use the app, use whatever it is that they should be doing to communicate back to the health center or to any healthcare provider is extremely important. And also one of these not reimbursed things that are really helpful to have a successful SMBP program. But I'd love to hear if you heard any more experience, and if there's anybody else on the line that is currently playing that role, if you could identify yourself for others to connect with, that would be great.
So I can just comment a bit. I know the health center that I was previously working with is now like onboarding an AmeriCorps member who will be taking over that digital health navigation role. I'm not sure specifically what their, job description will entail, but I know they'll be doing some of this work.
Lovely role for a AmeriCorps volunteer. Love to hear that. Thanks for sharing.
Thanks, Tyler. Thank you so much. Brittany Arthur has her hand raised. So I'm gonna welcome her to join the group discussion.
Hey, thank you. I wanted to sort of gauge what other people's experience has been, if you've been able to fully successfully get sort of that feedback loop of data and readings from patients in a timely manner back to the care team. We have tested this process in several different ways, where we have community health workers contacting patients every whatever the time frame is to say, hey, read off your readings to me. And then we do our thing and get it to the provider. We've tried the mHealth and iHealth connected devices. And, the fact is that the topography in our area does not allow for, we're in a really mountainous area, and many of our patients and employees and ourselves do not have reliable cell access at home. And they may or may not have internet at home. And that's not even a financial decision. It is an infrastructure issue. And so we struggle with getting timely data. It may be the CHW contacts the patient and then 3 weeks down the road, or even if it's only been 7 days, oh my goodness, you had a stroke level reading 6 days ago and we didn't know. So I'd love to hear thoughts on, what other health centers might be doing. We have tried it all and we are not finding the answer.
Thanks so much for sharing, Brittany. And just to echo, there's others in the chat that are empathizing with the same situation with not having that service in those areas. And so absolutely would love to hear from, so you're in Kentucky, and then we have Jessica, who's having the same situation in West Virginia. So definitely would love to.
Would it be helpful to offer some strategies to think that through? It's a tough one when you don't have internet access. That's very tough. And if you don't have both cell and internet coverage, that's doubly tough. A couple of things that come to mind is some of the apps will store the blood pressure readings in an electronic format. And even if there isn't available internet connection, once that internet connection is established, those values will flow, like you'll be able to see them. And that could happen maybe through a local library, or even, some if folks are coming into into a place where internet is available periodically. I'm aware of groups that have set that up as a regular cadence with the patient when they enroll them.
I appreciate that feedback. And just so to sort of level set with the rest of the folks, we participated in SMBP pilot in 2017. And then we did 2 different pilots, one with NAC during COVID and one with Centene. And we've done the paper and pencil, and that, I think for our population, that seems to be the most reliable.
Mm-hmm.
But even with, and so we've got some tech literacy issues in addition to health literacy with our patients, right?
Gotcha.
And that storing the apps that store the readings is a great resource, and it just pragmatically didn't work with our patients. I think the ability to be in town at a place where you're connecting with the internet in a way that's not an errand that you have to run to get your numbers to your provider, I think was a piece that we were sort of struggling with. So that's great. And I hope that it works. And we tested it and it did not work for us. I'm usually very positive, but I wanted to share that honest experience there.
Yeah. It truly is challenging when there's isolation.
Yeah, no, thanks for sharing, Brittany. And I really appreciate the networking and the sharing that's going on in this forum. I'm just looking at not only the verbal discussions, but the chat. It's just everyone's just really pitching in and sharing their experiences and how they've kind of addressed those similar issues. So Brittany, there's a lot going on in the chat. So if you want to take a look, they've worked with like scheduling, you know, cadence visits on a cadence. So I'll just kind of let you take a look, but they've definitely weighed in the chat. So thanks so much for bringing that forward. So we're gonna go to Crystal Fogel. Crystal, do you have a question? Would you like to join the discussion? Okay. Crystal, we'll definitely come back to you, but definitely want to go to the chat to take a look at what we have in the chat. So we have Lisa Sulin who put, if patients are using paper pencil to record readings, can those readings be used, counted for reimbursement since they are not automatically direct submitted?
And I don't want to get this wrong, so I'll let my colleagues correct me if I'm inaccurate. But the newest language in the HEDIS measure related to blood pressure does include as long as it's documented by the doc. So if you have, and Neha or some, if I'm stepping out, please let me know. But if you have a method by which then it gets into the medical record, it can be counted. Any corrections to that?
I actually think I saw Nar was on and had his hand raised. So Nar, if we can have you chime in, that'd be great.
Okay, Nar, I think I got you
There we
pulled up
go.
now. Sorry about it's a manual
Thanks.
process.
No problem. Yeah, so that is a great question, because for quality measures, there are certain requirements that Judy mentioned, but for the SMBP CPT codes that we referenced around increased coverage in those states, those SMBP CPT codes do not require digital transmission. So as long as a patient is able to relay readings back either via telephone, via paper pencil visit, or using some sort of digital mechanism, that would be considered relaying those readings back to the clinician. And I know we don't want to get into too much details on the RPM codes, but those also have different requirements around digital transmission of data. So it really just depends on the codes themselves, exactly what service is being provided, and then again how they are billed and reported. Hope that helps.
Yeah, thank you, Nar, so much for joining that and providing that information. Appreciate that. Okay, so I just want to skim real quick. I don't see any hands up currently. Definitely feel free to raise your hand if you have a question for our group, or just a sharing of your experience. Just want to make sure that we're catching everything also in the chat here. I would like to, while I'm going through and my team going through the chat and looking at the questions, I kind of want to go back to the article they had discussed earlier in our session, and discusses the delivery of SMBP during the pandemic and its impact on clinicians across the U.S. And so just want to see, how have you evaluated the success or failure of your SMBP delivery, and what indicators have you used to measure those? So what metrics are you using or have you used to evaluate either the success or the challenges that you faced or are facing with SMBP? Jessica says that they're looking at Azara AMA map measures. Wonderful. Thanks, Jessica. And Joyvel, we're looking at our overall UDS data for hypertension control. Okay, perfect. Okay. All right. And I'm going to open it up to my team to see if I've overlooked any burning questions that they have as well. We have probably enough time for one to two more questions before we move on to our next section. Haley mentions that we look at systolic BP changes for patients who have an SMBP order placed. And
there's a good question from Christina Dawkins about how blood pressure measures are getting documented in the patient electronic medical record. And Deb, I wondered if you had a couple of thoughts about different ways that the measures are getting documented in the medical record.
So, there's a couple ways. In some cases, there's a direct connection from the actual device into the EHR. In other cases, there is a connection from a repository of those blood pressures that are coming in at a specific cadence. And I think in many cases, it is a manual entry of that data into the EHR if it's getting into the EHR. And then I guess the fourth way would be through some sort of PDF. So we have groups that are using a repository of values, and then they create a report out of that repository that becomes a PDF and gets put into the chart. And that PDF usually contains all of the blood pressures in that particular date range, plus the averages, so that it can be reviewed by a provider. Is that what you were looking for, Judy?
Yes, thank you. I can't
Sure. The coming off mute piece is fun, right?
Yeah, even when I have control, I'm not waiting for Liam to give it to me.
All right.
This is Haley from the CDC team. And I know the first question you posed, Leanne, about the fact that the paper highlighted 58% of health center clinicians believe the SMBP should be continued to enhance hypertension care and patient engagement. And then the question, how does that align with your experience? I wonder if we could just ask for a thumbs up. I see the reaction option. If SMBP is valued in your healthcare organization and seen as a continuous part of the care provided to people with or at risk for hypertension.
That's a great question.
And
Haley.
this might be preaching to the choir, but also curious to hear if there's others that are feeling the opposite and maybe concerned about continuing SMBP delivery.
Yeah, those are great questions. I'm seeing a lot of thumbs up.
Glad to hear it.
Do you curious, just to kind of build off that, is do you like Haley asked, do you continue to see that continued confidence and you know I guess buy-in to continue SMBP and to use that to continue hypertension care? Wesley Hicks put some clinics have also begun identifying patients eligible for SMBP in the dental clinic. Oh, wonderful, through medical dental integration efforts. Oh, that's fantastic. That's wonderful. Thank you, Wesley, for providing that. And then Joyvel put, our main concern is sustainability and paying for our hypertension care manager and tracking patients in the program. And then James, one more question. James asked, anybody wonder why some of the office automated devices used in clinical trials no longer appear on the Validate BP site? Deb, can you?
Yeah, James, can you, are these devices that were originally on the Validate list and now have disappeared from the Validate list?
Yeah, I was thinking of the Omron devices that were used in some of the clinical trials.
Right.
I don't
Nar
see.
has his hand up. I bet he has an answer.
Yeah, I bet he does.
Yeah, James, yeah, great question. I guess the one thing I'll say is that we are trying to continue to get the VDL to reflect all of the validated devices that are out there and available. So we do recognize that there definitely could be some that may be validated out there, but just haven't gone through the process to get listed. So I definitely recognize that there are some of those office professional devices that again the manufacturers just haven't submitted for review. Although any way that you all can help encourage them to do so, I can give you the information to pass along to those manufacturers. And then we haven't actually removed any devices, but we have kind of reorganized and reconfigured the VDL, so it might look new to actually search and find devices.
Thank you.
Thanks, James, and thanks, Nar. So just in respect for time, we're going to move on, but rest assured, we will capture your questions in the chat and we will bring those back and to the team for answer. At the beginning of the forum, we also mentioned that we are going to post the recording and the slides and all of the related content on our Confluence page. So you will have access to all of this following the event. So I just want to quickly introduce Deb, who's on our screen. So Liz, if you can pull back up the slide deck while I introduce Liz for our Did You Know tip of the day. So Deb is a family nurse practitioner and a special projects director for population health at the Health Federations of Philadelphia. So Deb, take it away.
Sure. So I'm just going to take 1 minute or 2 minutes of your time, but it came to our attention that Johns Hopkins School of Nursing has recently published an article that demonstrated there was no significant difference between blood pressure measurements taken by a nurse in a clinical setting and those taken by a patient. The key here is a short 3-minute training video that all of the patients used. And if you go to the next slide, and when you get this deck, here is the video that was used. I've looked at it. I'll say that this is my opinion, but I think it's pretty effective. It is quick. It is clear. It is crisp. It's easy to follow. So I just want to echo that. For those of you who are really working to continue to advance SMBP, the instincts are correct that patients can learn how to do this. They can learn how to do it well and reliably, and there's a quick way of helping them to do that. All right, and I guess I'll turn it back to you, Leanne.
Yeah, thanks, Deb. And so we are going to move over to our updates, and I'm going to turn it over to Judy. Next slide, please.
Great, thank you, Leanne. And thank everyone for the questions. As I mentioned in the chat, they will be really good fodder for us as far as do we need another SMBP forum with a specific topic that we've left some of the unanswered questions. So come back and be at the next forum and we'll continue to be answering these questions. I want to take a few moments. There's 2 slides to share with you the 2023 hypertension control champions that we announced at the end of the year last year. Next slide. And hopefully you can see some of the champions that are near you to be able to get some of their advice about how they got to 80% control. And the reason that I'm sharing who they are is next slide. We are at that point of looking for the 2024 champions. And this is where we need all of your assistance. Do you know a practice that has good blood pressure control? And that means 80% control is what we're looking for to be able to recognize champions. And if so, we have learned I don't want to say the hard way, but if you are aware of somebody that you think might be getting that kind of blood pressure control, tapping them on the shoulder and letting them know that there is a chance to be recognized is often what it takes for the busy practices to think about applying for the recognition. The application process itself is relatively easy. It's online. It doesn't take tons of time. Once you get into the system and we look at the number of champions that we could look at, there is a commitment, but can be relatively brief of a couple of meetings to get to validate those results. So all of the champions that we are recognizing, we have looked at their medical records. We have looked at how they pull charts to be able to say that they really are at 80% control. Next slide. We are missing champions from these 8 states. It is my contention that there are champions in those states. They just haven't yet applied or been able to be recognized. So if you are in one of these states or know of clinicians that are in these states, encouraging them to apply again by the beginning of April 5th would be greatly appreciated. Next slide. And back over to you, Leanne.
Thanks, Judy. So I'll be real quick. We have a couple upcoming Million Hearts and partner events. Definitely encourage you all to register and join us. We have a learning lab on May 16th. We also have one of our SMBP forums on June 13th. And then we have a Million Hearts learning lab on July 11th. The links, we will put those in the chat, but also, again, they will be on the materials that you'll receive from us post-event today. So we really welcome you to join us during these events. Next slide, please. And then we listed all the resources throughout our entire forum today, plus an additional few extra goodies for you to peruse. We also, at the very bottom, have our Million Hearts Confluence page that has all of the content from today's forum and in the past. So we have all sorts of great webinars, recording slides, and links to resources and tools. And next slide, please. And again, we want to hear from you. So if you have, Judy mentioned, if you have resources or updates that you want to share, please let us know. We want to hear from you. Here is our email address. Reach out to us. We love connecting with you all, and we value the participation and the engagement. And next slide, please. And then I'll hand it over to Judy for closing remarks.
Thanks, Leanne. Thank you. Please register for additional forums. As I mentioned, we will be looking through the questions that we didn't answer or the questions that a whole bunch of you had where we need to probably provide a summary or try to provide a summary or a discussion spot. Again, really appreciate the questions and the answers. This forum is intended to be a community of people who are implementing SMBP, and the joint experience is what we're looking for. So we hear many of the obstacles that remain, and we applaud the efforts that are going on nationwide to overcome those obstacles and get to better blood pressure control through SMBP. So thank you all, and look forward to seeing you again in a few months.
Yes, thank you. And please complete our post-call survey. We'd love to hear your feedback. Have a great rest of your day, everyone. Thank you. Stay safe and stay well.